Welcome to Meet Us at the Table. My name is Kayla Smith, and I am a registered dietitian with Fresenius Kidney Care. And I'm here with Dr. Jameson, who is a local nephrologist in the DC metro area. Today, we're going to give you 5 tips for managing both your kidney disease and your diabetes, because we know it can be tough.
Indeed, it is very challenging with patients who have chronic kidney disease to make sure that their diabetes is well controlled and all the other factors like blood pressure is maintained to slow kidney disease progression.
Perfect, let's get into it. Today, we thought we would give you guys 5 solid tips on managing both your kidney disease and your diabetes. Tip number 1 is choose nutritious foods. Dr. Jameson, what does that mean to you?
It means that you're going to go for fresh produce. Fresh vegetables and fresh fruits are great for helping to manage your blood sugar, mainly because they give you a lot of fiber. So for example, for a snack, berries are great for you. And as long as you portion out your fruits well, you can add them to your fruit smoothies. You can have some grapes or some apples. Adding a little protein when you have your sweet fruit helps to decrease the spike that you would get in your blood sugar as a diabetic.
And as we're talking about the fruits, let's not forget the vegetables.
Absolutely. They're great for fibers also, and they're part of a well-balanced meal, giving you all the nutrients and vitamins that you need.
Yes, we're talking green leafy vegetables. We are talking
cruciferous vegetables like your cabbages, your kale, carrots are good. They're a carbohydrate, but they're also great with vitamin A. You're talking about other things like broccoli and all the things that we love to eat, right?
Yes, perfect. And it's not just fruits and vegetables.
No.
It can also be your proteins.
Yes, and that's your meats, of course. That's easy. We recommend that you have chicken and nice fish that has omega fatty acids like salmon, but it's also important to have some plant-based protein.
Correct. So as a renal patient and a diabetic, protein is hugely important. It helps stabilize your blood sugar. It keeps you full. And also with being a renal patient, your body requires a little bit more protein than it needed prior. So having options is great. Speaking about plant proteins is awesome, but let's talk about whole grains. Do you have any advice for our patients?
Yes, let's stick to whole grains like whole wheat bread, brown rice, whole wheat pasta, rather than white pasta or white rice, because that gives you more fiber that helps with better blood sugar control.
And fiber has a lot of added benefits. I know we've thrown that name out a lot today.
Yes.
So we're talking motility and helping our patients with constipation, because a lot of them suffer from
Constipation, yes, yes.
And like we mentioned, and everything that we've been talking about, it's the intersection between kidney disease and diabetes, and counting carbs is a big part of that.
Absolutely. So everything should be measured according to the serving size that's recommended for you as a diabetic to maintain good blood sugar control. And so if you're having fruits, you can't have a whole meal of fruits. You should have a portion size of fruits, which may include just a small apple or 18 grapes or half cup of berries.
100%. And our final item that we want to talk about are healthy fats.
So you like avocado then?
I love avocado. Those are healthy fats?
Absolutely. It's good for guacamole, good for making a spread, good for eating in a salad. But you also have olive oils and grapeseed oil.
Yes.
And olive oils are good for making your salad dressing. So healthy fats can also be eaten.
Yes, they can also be found in meats like salmon.
Yeah, like salmon, great.
We spend a lot of time talking about the foods that we can enjoy, but people with CKD and diabetes need to be mindful of the foods that may also cause them some harm.
Yeah, there are things that they have to limit. Patients who have chronic kidney disease and diabetes have to be really cognizant of the fact that they can't have too much salt. And salt is contained in a lot of processed foods. Foods like deli meats, like sausages and cheese have salt that's used to preserve them. And that's going to make you thirsty and want to drink a lot more fluid, which stresses your kidney. So you have to be mindful that too much salt is not great for you as a diabetic chronic kidney disease patient.
What about the added sugars, Dr. Jameson?
That can be just as harmful. So read your labels carefully. You're looking for added phosphorus as a preservative. You're looking for added sugars, which is a lot of time used as also to help to preserve things. And you're looking for added potassium. Now, potassium is contained in foods that are fresh also, but very high in canned tomatoes and some other foods. So you have to read your labels.
We've talked about the nutrients that are good for you, and we've talked about the nutrients to be mindful of. Let's talk about the meal itself, which takes me to tip number 3. Don't skip meals.
You're right, Kayla. Skipping meals just puts your body in a roller coaster of blood sugar, up and down, and that's not good for diabetics. We want you to have a steady state on your blood sugar, so that means not skipping meals, because that sets you up to overeat on the meal when you're very hungry, and then your sugar gets high and then it drops low and you wait too long to eat. So let's not skip meals.
This might be your easiest tip yet. Every meal, every day.
Absolutely.
I don't know about you, Dr. J, but I like to spice things up.
Oh, you do, huh?
I do, and one of the key points of managing your kidney and diabetic diet is to substitute salt with other spices.
Absolutely, and that makes your food taste delicious. Instead of using salt to flavor food, let's use our herbs and spices. We have lovely things like cumin, a little bit of spicy pepper, some Italian seasonings, onion and fresh garlic, fresh basil, fresh thyme. These add flavor to your food, making it more delicious, and you can limit your salt in this way.
Just because you're living with kidney disease and diabetes does not mean your food has to be boring. Which brings me to tip number 5, plan for deliciousness.
Yes, that means that you should plan your meals. Check out recipes, go grocery shopping, and know what you're going to be eating throughout the week so that you can have delicious, healthy meals that make you feel good.
Plan for success.
Yes.
If you need any help building your own personal meal plan, please visit us at freseniuskidneycare.com/recipes to browse our library of diabetes kidney-friendly recipes. On behalf of myself and Meet Us at the Table, thanks for coming, Dr. Jameson.
It was my pleasure to be here.